Hello, Mrs. Doe. How are you feeling today? My name is Stephanie, and I will be your nurse. Do you have any jitters or concerns you would like to address before we get started? If not, then I would like to discuss the plan of procedures so that way you know what to expect today. As you know, you have been diagnosed with a very common and luckily highly treatable form of skin cancer. The purpose of this surgery is to remove all cancerous cells with the goal of saving as much healthy tissue as possible. The type of skin cancer you have is called basal cell carcinoma, which is abnormal uncontrolled growth, that arise in the skin's basal cells. Basal cells are the deepest layer of the epidermis. It is not as dangerous as other cancers, which, as you can see from the picture, the epidermis is the very outer layer. Here is the dermis, and here is fatty tissue. We'll be working basal cells line right in here, which is where we will be working. So it's not something that can spread through blood vessels and into the rest of our body if taken care of swiftly, but your treatment involves Mohs surgery, which will be performed by your dermatologic surgeon. I will start by cleaning the affected area that we'll be operating on today, and then a surgical drape will be placed on your cheek. Be forewarned that the drape will prevent you from seeing what is happening, but the doctor will be talking you through every step of the way as he goes. I will then use a local anesthetic to numb the area so that we feel no discomfort as you will be awake the entire time. The surgeon will then use a scalpel to remove the thin layer of skin surrounding the visible tumor, after which you will be bandaged up and able to relax in the office while the lab analyzes cancerous cells layer by layer to confirm how deep it was and if we're able to remove it all. If the doctor still notices some remaining cancerous cells deeper than expected, then we will repeat the process. The procedure will be done in one day. Most time it will be done in as little as 3 hours, with the things that can influence the length of the surgery if the tumor is deeper than expected. So imagine that tumor being like a tree, and those roots can run very deep sometimes. Our main goal is to save as much healthy tissue as possible, so we'll be doing this, and so we will be very precise in everything we do in order to ensure that we get everything out. So plan on being here all day. With every surgery, there is permanent scarring, so what we focus on is minimizing any signs of deformation. Your surgeon is very skilled, so that's not something you have to stress about, but I would like to stress that scarring is inevitable. Another important thing to note is that you get a better cosmetic result is if you keep it lubricated with antibiotic ointment in between the changing of dressing. So while we're on that subject, I would like to go over all aftercare and discharge instructions with you. What you have on your cheek will be an external dressing, and I want you to keep those on for the next 7 days. For the first day, do not remove or change the dressing. Keep it dry to prevent bacteria from being trapped underneath. If you're feeling any pain or discomfort, apply an ice pack to the dressing every hour for 10 minutes. It is suggested that once you leave here, get your prescription filled and take prescribed pain medication with food or as directed consistently, so that way you can ensure that you stay ahead of your pain management. Treat the first days as if you were on vacation. Relax, don't go to work, and avoid exercise. What we're trying to do here is prevent any unnecessary movement, so that way your blood pressure is not going up. Once your blood pressure goes up, that causes more swelling and bleeding in the wound. On day 3, you can start changing the dressing daily. It is important to follow the doctor's wound care instructions that is followed, so that way you promote the best healing and little scarring. I will schedule a follow-up appointment with you in 1 week. During this appointment, we'll be removing stitches and reviewing preventative measures, such as sunscreen and yearly dermatology exams. If you have any questions, just let me know. Again, my name is Stephanie Alexander. I'm in medical terminology 53. Thank you for watching this.